So I have to wait 29 seconds. So everybody just hang tight. I have to wait another 23 seconds before I can turn on Insight Timer. And then
Sure.
we're going to be
How's the
back.
weather up north?
I think it's going to stop raining. It's been raining, but I think it's going to stop.
Oh, so it's moving that way, huh? We had a little bit of drizzle, but it's look at my beautiful sunshine outside my window now.
Welcome, everyone. We're finally on, I hope, enough channels. I got everything working, I think. Okay, so quickly, I'm going to turn this over to Professor Kwok. She's uh, been very, very busy. We finally got her to come and do another presentation on, this time on psychedelics. I feel like I'm back in high school again, or at least college. So with that, I'm gonna turn it over to Dr. Clark.
Thank you, Danny, if I may. And hi, Venerable Hong, and all of the people on Zoom, and every one of you who are on all the different channels right now. My name is Joanne, or I'm commonly known as Dr. Kwoh. I'm signing on um, the other computer because I'm going to share my PowerPoint soon. While I was talking with Danny about what to present today, I have so many topics coming up because besides chairing my psychology department at University of the West, where Venerable D. Hong works with me and he teaches one of the classes called Buddhist Psychology and Addictions Theory, I also teach. So this semester I'm teaching psychopharmacology. And as I teach, this is the one thing that I love about teaching. When I teach, I learn. I've learned so much. So from 2023, when I just came on board, when I knew zero, nothing about psychedelic assisted therapy, to now, tonight I'm presenting an overview on psychedelic assisted therapy. I really want to share with every one of us how quickly advancing we are in this area. And then hopefully I'll be able to help share some myth busters about what the misunderstanding out there. Because while I was teaching using this PowerPoint that I'm going to share with you this evening, we realized something about ketamine session that we at first thought was part of the psychedelic assisted therapy, but it was not. But I'll get to it in a minute. Just right before I share my screen, a student that I was advising for fall about what courses to take, he told me that a bill was signed today by the government to approve psychedelic assisted therapy to be legal. So if you didn't know before, yes, it is not legal. Maybe some of our information will be outdated since the bill was signed today, but we'll see. Let's take a look. So this was a slide PowerPoint that I prepared for what I taught, what I'm teaching this semester, but this was week 9, I think. We are in week 13 or 14, 13, I think. 3 more weeks before Venerable Dia Hong and I can go on vacation. So during this week, I lectured on two things. It's almost on the two opposite ends. One part it's about psychedelic assisted therapy, and the other one I choose to always lecture on holistic healing. I don't think we will have time to go into that this week, but we can save that for the next time when I return, if I'm invited to return. So what are psychedelics? Um, as you can see from this diagram, it's more than Venn diagram. It's, you can call it a Joanne diagram, or maybe I should give credit to whoever who drew that. There are so many overlapping areas, but the common ones that we know that are named as psychedelics are MDMA, LSD, DMT, lots of abbreviated names. That's because they are chemicals. They are very long names. Some of them, such as those that you see here, tryptamines. Um, I can't even pronounce that. I'll try phenethylamines and tryptophan, serotonin. I think it's a more commonly known um, neurotransmitter. and also a chemical, what you call that, a synthesized chemical that we can get, usually found in antidepressants, and so on and so forth. So you can see that psychedelics are chemicals, and most of them made, if not all of them, are made in the lab for us to use to treat certain conditions, to use against certain conditions. I'm not sure if you have heard of ayahuasca, but that is supposedly a kind of mushroom fungus per se, and it's mostly found in the Amazon area. Ibogaine is one of those, in the same family as ayahuasca, as I was told, and mescaline. So this is from the textbook that I used to teach this class, psychopharmacology. So psychopharmacology is made up of, two components, psycho and pharmacology. If we are talking about pharmacology alone, is using drugs, licit and prescription drugs to treat certain medical conditions. But if we add psycho in front of the pharmacology, then this category of drugs are psychotropic. They are used for treating psychiatric conditions. So the history of these compounds, and we're talking about psychedelics now, goes back to prehistoric time when such psychedelic agents such as psilocybin, still not legal for prescribing. Peyote and ayahuasca were used in rituals and shamanistic practices by many technological societies. So in 1938, someone invented LSD, Dr. Albert Hoffman, a Swiss industrial chemist. He ingested microdoses. Microdoses means, not big, huge amount of LSD. So LSD stands for lysergic acid diethylamide. Diethylamide. I'm not pronouncing that word right. In his research laboratory, rode in his bicycle and experienced his first trip. So, common slang among the younger generations, such as the millennials and Gen Z, we will always say, are you tripping? We are actually referring to, are you high or are you on some substance that you are not thinking clearly? So he described and documented his first trip, which was a vivid and good one. And he actually named this day, April 19, which was not too long ago, 2 days ago, by International Bicycle Day. Interesting note, although marijuana or cannabis is not in the group of psychedelics, it's in the group of hallucinogen, where a lot of different names that I mentioned earlier before, LSD, MDMA, they are all under the group of hallucinogens, as compared to the other groups called depressants, which includes alcohol, or stimulants, which includes caffeine or nicotine and definitely cocaine. But this group of hallucinogens, back to marijuana that I was saying, cannabis. Yesterday, 420, is International Marijuana Day. If you haven't known that, today I'm sharing that fact with you. So among college students, when we say, oh, it's 420, and we know what that means, it's referring to weed. So during the turbulent 1960s, the counterculture backtrips, the ill-fated Harvard psilocybin project of Dr. Timothy Leary and Dr. Richard Alpert, and the 1970 Controlled Substances Act placed these different substances that I just mentioned into CDS Schedule 1. So CDS stands for, controlled substance. Schedule 1 is the highest schedule, which a lot of these psychedelics and hallucinogens are still under Schedule 1, making them illegal. So, and in 2006, a banner year for psychedelic research, a banner year for psychedelic research into clinical application, several significant events occurred, making the modern renaissance of psychedelic research. I will show you a little table of what these different landmark events. So I'm not going to go ahead and read the whole paragraph, but in a nutshell, psychedelics started then in the 30s, and then which were kind of, basing on what the ritualistic practices were in the ancient times or not so recent times. And then someone developed in the lab, they realized that they give good trips, and Of course, there was abuse. There was there were users were not for the intention, and there was a counter to it. And then after going through the up and down, psychedelics are now back into the picture. So this is a little table of timeline of the history of psychedelics. Just letting you taking a quick look. The first few ones like the prehistoric 1938, 1950s up until 1960s we just talked about, and also the Controlled Substance Act. And now we have the comeback of psychedelics. Okay. If you want to remember, April 19 is International Bicycle Day because of the discovery of LSD. So now let's get into the meat of the topic today. A lot of people feel that, or misunderstood or thought that when we say psychedelic assisted therapy, that means you go into a therapeutic session or going to see a therapist, and then you have some psychedelics, consume, ingest, hooked on, or being assisted by a machine, and you talk about your um, psychotherapeutic concerns in that setting. It is not that. So a proper psychedelic assisted therapy looks like this. We will have to have an initial evaluation. Usually psychotherapy, maybe I can use the term PAT. PAT is only recommended or suggested when someone has a condition that is very treatment resistant, such as major depressive episode, perhaps PTSD, or something that is deeply rooted in more of a trauma informed kind of situation that the person is not able to get in touch with those emotions unless there is some kind of assistance, such as a psychedelic substance. So the initial evaluation would then evaluate, has this person tried this? Has this person tried this and this and this? Is this possibly the good match or good result or good outcome, or rather a good substitute per se, or avenue for this person to try PAT? So up to 3 brief meetings with lead psychiatrists to taper medications before they even go into the therapy sessions. So you can see that people who are being evaluated to see if they are fit for psychedelic assisted therapy are living with psychiatric conditions because they have a psychiatrist and they have medications. So we're not talking about day-to-day depression or anxiety that we have one medication that, or acute adjustment disorder. We're talking about people who are resistant to medications and psychotherapy. Now, before they get into the actual dosing session, they are going to have 3 therapy sessions. How that would look like will possibly differ from therapist to therapist, but if they all were to train them the same way, it will be along the line of how do you think you would react? And if you react this way, how would you respond to that? And so on and so forth. It's more of a psychoeducation per se to help them understand what the dosing session looks like and how they can feel safe and supported during the dosing session. So there is a last preparation session that leads to the dosing session. Dosing meaning you are experiencing that psychedelic substance. And then first integration on 3 consecutive days. These things happens together. Or rather 3 consecutive days. It's not like this week I do the last prep, next week I do the dosing, and then after that a week later I go back and talk about how that went for me. It has to be 3 back-to-back days for the last preparation, the dosing itself, and then the integration session. After that, then we will have follow-up therapy sessions that includes the integration, all in all 3 therapy sessions to complete 1 psychedelic assisted therapy. So the first myth was that, oh, I'm under psychedelic assisted therapy, meaning that when I see my therapist weekly, I go under dosing and then we talk about things. No, a psychedelic assisted therapy, it's a very tailored, customized, structured therapeutic intervention that has a very clear beginning and a very clear ending. So,
Joanne,
there's, yes.
can there's just, I want to make sure that these questions are relayed to you in a timely manner. So I have one student that just asked a question. I think he knows, he's quite familiar with the topic. He says, where does PAT take place? In the USA, other countries, and how are the psychiatrists trained?
The information is coming up. So
Okay,
yeah,
okay,
if I
okay,
didn't cover any of this information, and if you have a question, yes, please do ask Danny in the chat,
okay,
and then we'll try to cover that. So yeah,
okay,
that
okay,
the following slides will cover some of those
okay.
questions.
Thank you so much.
Thank you. So these are the different psychedelics that I covered in the first couple of slides: ketamine, LSD, DMT, MDMA, and psilocybin. They also are called magic mushrooms out there, supposedly. Now, the next few slides, I actually did get my information from this place called Desert Cove Recovery. So it's a inpatient substance recovery or rehabilitation center that they are talking about psychedelic assisted therapy. So these are the different psychedelics and what are they and are they legal? So that somehow answers the question that Danny has just brought up for one of the attendees, which is not all. We have more answers coming up. So are psychedelic therapies effective for treating addiction? So many universities and clinics are attempting to assess the effectiveness of psychedelic treatments by using long-term trials. So that's a hint right there for you. The trials are legal. And according to the conversation that I had with someone today, it is more strictly controlled in Southern California. It is more open and available in Northern California. I'll probably, after my presentation, will check in with all of you or most of you who live in Northern California and see if that's the same sentiment. So the aim is to discover if these treatments can be targeted to have a beneficial effect by altering the brain chemistry, opening up to new neural pathways so that we can rewire someone's thought patterns, someone's belief systems per se. And how? Because psychedelics actually trigger the production of serotonin and other hormones in the brain. And these substances can affect a person's mood, worldview in that sense, and risk of addiction. Some people would say, when your mood changes, your worldview changes. In a way, if we talk about your mindset about certain thing, I got upset, by someone cutting off my lane when I was driving. If I was in a bad mood already, if my worldview is this world is full of losers and haters, what do you think, or how do you think I would react to the road rage? I will be angry. I will be, maybe be rude by lifting a finger or cursing and swearing. Or if my mood is not as bad or my worldview is not as narrow, wider, thinking, these people might be going through something. I may be a luckier person than this other person who is experiencing that. I'm going to let it go. So, with that kind of thinking, it is not just, clear your mind. Your mind, if you think this way, you will. If your thoughts and behavior align, that is kind of a behavioral and system. It is also a biological system. The more you think of one kind of way, the more your brain develop neural pathways to continue to shape your brain or your neural pathways to be more persistently thinking that way. So the more I am having a different or more wider worldview, the more I practice it, the more persistently and consistently that I'm able to think of the world that way, that the world is not full of losers, the world is not full of haters. I can let things go. So this may help people break existing cycles of harmful or toxic behavior. Now, however, it is difficult to track the impact of psychedelics due to the complexity of the brain. Hormones and endorphins can be released in the brain due to the other activities like exercise. For example, we were saying, oh, he's going through psychedelic assisted therapy and he's got endorphins and hormones, good hormones going on. It must be from the psychedelics. This person might also be doing yoga. This person might also be doing light walking. So it's hard to say that it's hard to pinpoint the cause and effect per se. So if a person exercises before their treatment, it is difficult to equate a positive change in the mindset due to the treatment. How does psychedelic therapy work? So psychedelic therapy can be broken down into three basic steps. Consultation phase, I show you that part, to evaluate whether the client is a good candidate. And in this case, they also include any allergy problems. So if you're allergic to a certain kind of substance such as ketamine, then definitely you don't want to have ketamine in your system. And then the second phase is ingestion, which is two parts. The patient ingests the prescribed psychedelic substance via oral consumption. There are so many ways, so many routes of emission or administration of a drug. It can be oral, it can be dermal, it could be intramuscular, it could be, the best way, of course, is through your veins or IV. So injection is the way to inject the substance into your bloodstream, and that kicks off the effects of the substance the fastest. This is done in the presence of a trained therapist. The patient undergoes a psychedelic experience. The therapist will listen as the patient talks and only intervenes to offer support, like holding their hand. Integration phase, the patient and the therapist discuss their experience to explore the meaning. So if you were to think about a few slides back of the proper structured PAT, this would be the the preparation therapy, dosing, and then integration. Some of the commonly known pros and cons. So psychedelics may help treat people with addiction or substance abuse issues when other treatments have failed. Another pro is that some evidence suggests that it may help resolve disorders caused by neurological conditions or brain development. And more research means that it is becoming increasingly safer to use, because if it's not good, if we have been hearing bad things, then this would have been discontinued. No one would even ask or request that this be a legal intervention. Some cons would be that it can cause physical side effects such as headaches, elevated blood pressure, and hallucinogen persisting perception disorder. It means that you might have some kind of hallucination or induced psychosis. Due to their intensity, it is important that the drugs are only administered in the presence of trained personnel. You can't do it on your own. Psychedelics are not available to the average person, so the most in need of it do not have access. We're getting into the legality part. So, are they legal? Psychedelic therapy is not legal at the federal level, regardless of their use. So, I think the question also asked about other states. I have to apologize that it's not within my research boundaries that I check if the other states are also using, but as I have found out, according to my teaching and research, it is very much within California. Maybe not even outside of California. I'm not sure about Washington State, but it's completely not a case for consideration on the East Coast, is what I found and heard. So anywhere in between East Coast and West Coast, I haven't researched, so I don't have a definite answer for you, but it is pretty much a California thingy at this moment. This means that only scientists and certain university students or clinicians can safely use and administer psychedelic treatments. Many students train to administer psychedelic therapy without any actual access to the drug. So we will simulate the process, the structure, right? Evaluation, 3 sessions, dosing, then integration, then termination. there's no drug. So they are trained doing this, but they have not actually seen the drug or seen the client who is under the trial being under the influence of the drug. However, sorry, hold on, let's talk about other limitations. These limitations currently make widespread psychedelic therapy unlikely for most people. So if I did mention about the bill signing this earlier today, before we started this, it might remove this limitation right here. As in, since it's becoming legal, so that means more universities or more clinical settings can now use or promote or train people to conduct psychedelic assisted therapy, then these limitations will be more or less removed. Although the efficacy and risks of psychedelic treatments are unclear, there are many tried, tested, and successful treatments that can help people to overcome substance abuse or addiction. Now, this, like I say, is done. These slides and information are provided by Desert Cove Recovery. So they are a recovery center that offers comprehensive, supportive outpatient care, medical detox, or 12-step programs. So if psychedelic assisted therapy is not available out there, they are saying that you can still come to us using non-psychedelic assisted therapy for recovery. So more about ketamine. I'm going to play the video if it allows me to let us know what is this ketamine. Let me know if you can hear and see.
Ketamine was initially developed as an anesthetic, but today it is also used as an analgesic and an antidepressant. It has been used as a recreational drug since the 1970s. After administration, ketamine is rapidly and extensively metabolized into an active metabolite called norketamine, which is thought to play an important role in ketamine's anesthetic and analgesic effects. Ketamine and norketamine both act at a receptor for the neurotransmitter glutamate, called the NMDA receptor. Glutamate is the primary excitatory neurotransmitter in the brain, and ketamine and norketamine act as antagonists at the NMDA receptor, which means that they block the receptor and inhibit activity there. Inhibition of NMDA receptors can substantially affect neurotransmission, and is thought to be critical to the anesthetic and analgesic effects of ketamine. While most other antidepressants can take several weeks to achieve a therapeutic effect, ketamine can begin to improve depressive symptoms within hours and last for up to 2 weeks after a single administration. The mechanisms underlying ketamine's antidepressant action are not fully understood, but it's thought that it cannot be explained by NMDA antagonism alone. One hypothesis is that another glutamate receptor, known as an AMPA receptor, may play a key role. AMPA receptors may be stimulated indirectly by ketamine or directly by other ketamine metabolites such as hydroxynorketamine. Stimulation of AMPA receptors may lead to the activation of multiple signaling pathways and downstream effects such as new synapse formation in areas of the brain like the prefrontal cortex and hippocampus. These synaptic connections may bolster neural circuits involved with regulating stress and mood. Ketamine also acts on a number of other receptors, however, and there is still much more to learn about ketamine's antidepressant mechanism of action. Additionally, more evidence about the safety and effectiveness of ketamine needs to be collected for more physicians to support the use of ketamine as an antidepressant.
I'm like a DJ trying to control my audio now. So I hope everyone was able to hear it, but if you weren't, I hope the captions on the screen was able to help you understand of some of this. I don't pretend to understand all of this. It is not actually easy to understand all those science of neurotransmitters and how they work in our brain. But that gives us a quick overview of what ketamine is. All right. So not gonna bore you with all this information. Some of them is a little repetitive and too technical for tonight's presentation's purpose. But I want to say that ketamine is a very strong drug, and it is very similar to PCP, and it was developed by this pharmaceutical company called Park and Davis. When they thought that PCP was dangerous, they developed ketamine instead. So it's synthesized. All these are all made in the lab. And it was found to be successful as an anesthetic for medical procedures, especially in children. However, it is also used for animals. So you can imagine how powerful it is. So it produces adverse reactions experienced by some patients similar to those who were given PCP. They include agitation, disorientation, blurred vision, and hallucinations. It is marketed commercially as an injectable liquid, and on the streets, I believe they are used. They are sold as pills. They are pressed into pills. It's an illegal recreational drug. All right, and let me see anything else that I say. So those using illegal street ketamine reported feeling detached from their bodies, sense of depersonalization, and so on. So far, I want to tell you that ketamine doesn't have too good of a reputation out there. Now, if you're ready, I'm going to show you a live ketamine treatment session. And this is where I want to show you and share with you that how I learned through teaching this class, that after watching this with my students, that we realize this is not part of a psychedelic assisted therapy. However, it is a ketamine treatment session. It can become part of a dosing session, but this, however, is sold as an individual session by a clinic somewhere in Southern California. It was in Beverly Hills before, but it's moved to Downey or Torrance now. The name of the clinic is in the video. Let's take a look.
This is incredible.
Joanne, I think you have two
Like
sessions, so you have two mics.
to feel this connected
There's some echo.
to everyone.
You've likely heard of the drug
Perfect,
ketamine.
perfect.
Originally discovered in 1962, it's used in hospitals for surgeries and procedures of all kinds. In the 80s and 90s, it became a very popular party drug, but today it is being used as a treatment for severe depression, anxiety, PTSD, chronic pain, and more. MedCircle producer Bridget and myself went to Beverly Hills, California to get our very first ketamine infusion treatments. It was incredibly eye-opening and insightful, and I hope you find the same insight in this documentary. If you've not subscribed to this YouTube channel, please do. It helps us spread this credentialed mental health information to those that need it. Enjoy this program, and remember, whatever you're going through, you got this. Ketamine is a research-backed medication that's providing a fast path to relief from mental health issues for patients who just have not responded to traditional treatments. But not everyone is a candidate. Before we received our infusion, Bridget and I underwent a thorough screening process with the doctor. We also consulted with our personal psychiatrist.
I'm Kyle. This is Callie. Hey, Callie. Hey, I'm Dr. Sawyer.
Hey, Bridget.
Hey, Bridget. Nice to meet you as well. It's not one that. It is, yeah.
So they ask for all the normal stuff, and then they go through your mental health history, which most doctors don't ask in this much detail. And then they go through your general history as well. And then just now, you're going to take the Beck's depression inventory, see how depressed you really are. I know people who've had ketamine because they were in a hospital going into a procedure. But I don't know anyone, I didn't even know ketamine was a street drug until we started to do this story. Let's see what my anxiety score is. So I filled out the Beck depression form and calculated my score. And it's a score from 1 to more than 40. And I'm a 36, which puts me in the severe depression category, which, considering my history, does make sense. Then I did the Beck anxiety form, and on a scale from 0 to more than 36, I am a 26, which puts me in moderate anxiety, which is between 22 and 35. So I'm on the low end of moderate anxiety. And I'd say that's true. Most of the time, I'm not very anxious. So that seems in line with how I actually feel and view my own mental health.
My name is Dr. Michael Stoyer. I'm the founder and owner of the Pacific Ketamine Institute, PKI, here in Beverly Hills. I'm an anesthesiologist in terms of my background. I did my anesthesia residency training at Harvard, Massachusetts General Hospital back in the 80s and early 90s, and I've been in practice for approximately 32 years.
And we just did 20 minutes of paperwork between the two of us. We give it back to you guys. What are you using that paperwork for?
We want to make sure that ketamine is safe for you, that there aren't any so-called contraindications or medical aspects of your history that would preclude you from having ketamine infusion. Somebody with uncontrolled high blood pressure, somebody who's allergic to ketamine, which is very unusual, somebody who has, let's say, schizophrenia, somebody who has a problem with their liver, let's say somebody has hepatitis or liver failure, because ketamine is metabolized by the liver, it wouldn't be appropriate for somebody like that. Ketamine is very useful for depression and anxiety. It's also used for PTSD. It has been used for addiction disorder. It's been used very frequently for bipolar disorder. It's now being thought to be helpful for migraine and certain types of neuropathic chronic pain. We've seen tremendous benefit from people who've been very frustrated with the traditional modes of treatment for depression and mood disorders, depression, anxiety, OCD, where people have really felt stuck using SSRIs, SNRIs. What are SSRIs? Drugs like Zoloft, Prozac, etc., Lexapro. When you first start your initial ketamine infusion, what we'll do is we'll bring you back into one of our very comfortable deluxe rooms where there's a very comfortable reclining chair.
Here we go, ladies and gentlemen.
We're going to pre-treat with a drug called Zofran, which is a very powerful anti-nausea drug. I'm sorry about that.
And are there any side effects of getting Zofran besides not feeling nauseous?
That's pretty much it. It's a nice side effect too.
And I'm getting it right now.
I'm going to give it to you in a second.
I'm not afraid of needles or blood or anything like that. I thought I'm nervous, so.
That's okay. It's already nervous for this.
But nervousness and excitement are the same emotion. It's just on different sides of the coin, so to speak.
Yeah.
So I think it's just excitement.
That's right.
Yeah, you gotta tell yourself.
We tend to dim the lights because during ketamine infusions, patients' senses tend to be very heightened. You tend to hear sounds, noises much more intensely than if you had not been on ketamine. The same thing is true with the visual experience of ketamine. So we tend to really kind of mute the experience so that it's not overly sensory overload for you. People are always a little nervous the first time. After that, it's like, I know what to expect.
Okay.
But this is like nothing you've ever experienced before. So
Yeah.
it's understandable that you're a little bit nervous. I would be.
Yeah. And I've never done it recreationally, so I have no idea what to expect.
Here we go. I feel nothing yet.
Plugs in, ready to go. Can you feel it yet?
I think so.
Pretty soon it's gonna be more than I think so. Okay. You're just starting to get there. I'll be back in a few minutes, okay? Okay.
So what should I do right now?
Just kick back and relax.
Have you asked me anything?
How's it going? How's it feel?
Incredible.
What are the thoughts that are in your mind?
That we're all connected, that we're all together, that it's just so clear, like we are all in this together.
What is this? We're all in this together. What is this?
Well, I mean, like our lives, our purpose, our soul. We're all, it's crazy how we're all together.
Yeah.
I can tell that I'm very uh everyone feel what it is like to feel this connection to everyone. It's incredible. On a science level or a neurological level, what's going on during the treatment?
During the treatment, ketamine is known to modulate the so-called glutamate receptors in your brain. Glutamate is an important neurotransmitter in the brain. It's an amino acid. It's one of the building blocks of protein, but it also is involved in the signal processing of brain chemistry. And it tends to open up different foci in the brain, different areas that help make you feel much better in terms of your mood.
I didn't have.
This is
Yeah.
This is incredible. Yeah. This is amazing. I wish people could hear what I'm hearing right now. You know?
Total. What does the sound like?
I just I feel really like grounded. I wanna go back where I like got it.
Do you already feel a lot more normal?
No, I can still feel the effects of it right now. That was incredible.
How's your mood right now?
It's pretty good. Yeah, I feel
Compared to usual, let's say on a scale of 1 to 10, with 10 being the most, just the best you could ever imagine feeling, completely euphoric. Where would you say you are now? On a scale of 1 to 10, where would you say you were before?
before I was probably at a 5. I would say now I'm at 8 or 9.
Beautiful. That's awesome.
Yeah, I had a lot of anxiety coming here.
Mm-hmm. So you feel
and
more calm?
I feel a lot more calm. I typically have an anxiety that follows me everywhere, and I don't have that at all right now for the first time in a really long time. So,
That's really fantastic.
Yeah.
Good.
feels really good.
I made a believer out of you.
Yeah, you did.
Ironically, I feel clear-headed, even though right now I know I'm not clear-headed.
You're clear-headed but sleepy.
Yes, exactly. Right. Yes. I mean, just really incredible experience. Really, wow. Just, man, I didn't want that to stop. I didn't want it to end. I want to stay in that space of like.
Let me ask you a question. On a scale of 1 to 10, with 1 being the worst and 10 being the most happy, the most relaxed, the most calm, where were you before and where are you right now? On a scale of 1 to 10.
I don't think you can use a scale for this.
Off the charts.
I don't think a scale is a good measuring tool for this 1 through 10. It doesn't work for this.
Not linear.
It's too great. It's too great. It's probably been 30 minutes since our treatment. I feel a little dizzy and actually a little nauseous.
Oh, really?
Yeah. It's not bad or overwhelming, but I wouldn't want to go for a jog right now, or I wouldn't want to read a book. You know.
Mhm.
Fortunately, the nausea passed in about 30 to 45 minutes, and the days following, I felt noticeably better. I wrote down my thoughts and recapped the experience in an article that you can read using the links below. Bridget also shares her experience with ketamine infusion treatments, whether we would do them again, and how long we notice the positive effects from the infusions. Again, you can read that and more using the links below. Would you ever try a ketamine infusion treatment? Leave your answers in the comments section below. And thanks again for watching.
All right, we're back to this computer. Is everyone hearing me okay?
Yes.
And that's all the videos that we're going to watch today. These are some of the last two slides, all right, of this presentation. So I just want to kind of let us share together and know what could be the psychological and therapeutic effects when a psychedelic is consumed. Psilocybin is a kind of mushroom. It's associated with blissful feelings and a greater sense of well-being, and the benefits in reducing symptoms of depression and or anxiety in patients with treatment-resistant depression. When I first come into knowing psilocybin, it's very specific for depression, for very severe depression. Additional mental health issues and cancer patients can also benefit from psilocybin. MDMA reported increased access to emotional material, as in maybe sometimes you didn't know that you have something that you had an emotional reaction to it before. You might be able to access it after MDMA. It may also induce anxiety and mild cognitive and psychomotor impairments. Psychomotor impairments could be psychomotor retardation or psychomotor agitation. So agitation would be very irritable, tapping, always want to move around. Psychomotor retardation could be slowing down, or what you saw the host who was undergoing that, he's completely slowed down. Everything was almost 5 seconds slower per se, in my perspective. Treatment-resistant PTSD experienced a decrease in PTSD symptoms after MDMA-assisted therapy. I remember when I told Danny that I'm going to present on this, he says, shall we label our talk as the benefits of PAT for PTSD? I know there are some research out there. I know there are some claims out there, but I, as a lecturer, as a professor, cannot per se advertise or publicize my opinion as in, oh yeah, this is a very good way to treat PTSD. There is research out there, but we're not one to endorse or not endorse. And plus, actually, personally and professionally, I do have some resistance about PAT or psychedelic assisted therapy. Now, LSD and ayahuasca, sorry, it's a little cut off here. They are less convincing, although may emerge with additional research. I know one of my clients that I treated, she had some anger issues, she had depression history, and she had an ayahuasca experience. She went to the Amazon. I can't remember for how long, but it was a long period of time that she went, and it was very eye-opening for her spiritually. And this was back in 2019. I don't know when she went the first time, but in 2019 she was going to go again because she really felt that she benefited from that spiritual discovery. And let me see. Psilocybin, we talked about it already. Oh, sorry, that's the lower part of it. Ibogaine, I just Googled it. It's a African plant, herb per se. It is potential to generate, oh, I'm sorry. I was earlier talking about therapeutic. That means the pros. Now we're talking about the side effects. So psilocybin again appears to be well tolerated. Adverse events with participants appear to be rare. Adverse meaning bad events like trip. Effects on personality and mood appear to be dose dependent, meaning if you have higher dose, then there might be some kind of mood changes or behavioral changes as interpreted as personality changes. LSD appears to be well tolerated with healthy participants and participants with life-threatening diseases. Ayahuasca is well tolerated but vomiting in 50% of the participants. And ibogaine is potential to generate life-threatening cardiac arrhythmias. That doesn't sound like a good thing. Now, arrhythmias means irregular heart rate, and it could lead to cardiac arrest, or in common terms we say heart attack. But cardiac arrest meaning your heart goes out of rhythm, and that could be very fatal. MDMA has cardiovascular effects that may be toxic in crowded and/or hot places, or when combined with physical activity. Others suggest acute complications are epidemiologically rare. Specific dose-response relationships for individuals may vary according to genetic differences. And that's the end of my slideshow, but not the end of my talk. I'm going to stop sharing. Let me see. I'm not sharing anymore, am I? Okay. I think my screen now shows Danny or Dr. Mew as the main speaker.
Yeah,
With
you're
the
not
little
sharing anymore. Yeah, you're good.
logo. Did everyone hear the videos?
Yeah, yeah.
The
In
conversations?
in the beginning, when you have
Could you?
two,
Okay.
I think you have two sessions going on, so there was some echo.
Oh, sorry, my volume is turned down. Did you say something, Danny?
No, it's fine. It's fine. Everything's fine.
Okay. Yeah, because of the echo, so I turned down my main desk. So if you were
Right.
speaking, I didn't hear that part.
Anyone, particularly on Insight Timer, any comments, any questions? We have
Well,
76 participants on Insight Timer. There's got to be at least some comments.
okay. Is that your usual number, 76?
Just so
Or
you know, ketamine is totally illegal in Asia.
in where? Asia?
Yeah, in Hong
So is
Kong,
cannabis.
Taiwan, and in Singapore, you get 15
Death
years
sentence.
for using, 20 for trafficking, and 30 if they find you actually importing, plus about 15 whips.
Good enough, they don't get death sentence.
Oh,
Which I'm not
I'm
surprised.
surprised too. I actually had to look it up, and I thought for sure that this would be a death sentence in Singapore. But in Hong
Vaping
Kong,
is illegal.
yeah, in Hong Kong, it's been legal for a long time. It's the sort of the party drug.
But I want to go back to the question that you brought up earlier. I hope my rest of the presentation addressed that question, and if there's any follow-up question to that, I'll be happy to talk about it. So did you find out that if it's available in other states as treatments while you looked up internationally, Danny?
I didn't look, but I was going to comment the other way, which is that in the Bay Area, it's an open secret. You know, microdosing on ketamine that's what people do. You know, especially in the high tech competitive industry.
I mean, in the Bay Area or maybe San Francisco area, when the harm reduction model came out, remember harm reduction model, it's, be supportive of people who are still using substances, help them reduce harm by helping them come out of substance use or reduce dependency on substance less and less slowly and safely. So there was a huge criticism or backlash about needles collection center or social workers providing needles to people who were using substances to let them continue to use drugs but using safer practices. So that's a harm reduction model. So in a way, I do have a concept that in the Northern California or Bay Area or San Francisco area, it is more open and more accepting to be using, substances that are not legal everywhere else.
Yeah, I think that's sorry. I think when I look back, I left Hong Kong in 1971. They didn't have Kate then, but quickly it became sort of a party drug, and everybody knew that it was an animal tranquilizer when it was first introduced. And I think the big difference between then and now is that now people can afford to do it. Well, those who can afford it, they do it with medical supervision. And I think what's changing now is that as it becomes more mainstream, and someday it's going to be covered by insurance. So then, and it's just another thing that
Well,
we do.
you know, the star from Friends, Matthew Perry, Chandler. I don't know if you watched that sitcom. That was the
Yes.
10-year
Yeah, yeah,
series.
yeah,
You know how he passed, right? He passed
Yeah.
with ketamine overdose in his
yeah,
home because his prescriber didn't care how much they were giving him. They were just giving him because he asked, and they just continued to give him. And I think they were charged with the crimes that they committed, but I don't know how I didn't follow up with the story. But ketamine, the video, I want to talk a little bit about the video. It can be part of a PAT using that treatment in the video as the dosing session. But what we saw in the video that I want to clarify is that it's not part of a PAT per se. So these two individuals went for a trial on their own. They can book a session with the psychiatrist and have a dosing session, just like that. And I'm not sure if there's someone there who would advise them and say, oh, you can't do any more this month. You had this 1 month. I don't have more information about that. But that clinic, you can just go and fill up some questionnaires. Albeit they say it's very detailed mental health questionnaire before they are then under supervision to do their ketamine. And what did you notice in the gentleman? He was as high as he could be. And
yeah,
and when you are so sold on that pleasurable feeling, what does a person with a substance use history does? What would a person with a substance use history does? They want it again. And it's almost like a cross addiction. You
yeah,
want more and more of this.
yeah,
Yeah.
yeah. Oh, a comment from the Inside Timer goes like this: is that I do live in the Bay Area, but I did not know this. I'm so surprised that it is readily available in the tech community. I have heard it being used, but didn't know that it's so easily available. No, it's not easily available, not yet. But with the right amount of money, people are using it, and it's kind of known that it's just they call it a different name, microdosing. Whenever people say microdosing, that's what they use. Um, you mentioned one celebrity, the gentleman who was in France. Another one in the tech industry, right? Was the founder of, well, he started a shoe company. I forgot what is the name, and got bought by Amazon. And before he started the shoe company, he was actually a tech company. Uh, Let me see. What did this?
Zeppo? Is it Zeppo?
Zeppo,
Yeah.
yeah, that was a shoe company. One of there are two founders, and I actually know a little bit more. There's a theater on Van Ness in San Francisco that are owned by one of the co-founders, and the other co-founders actually started Zeppo inside the theater, inside the movie theater in the mall. And he died. He overdosed eventually. He was microdosing, but it's just like any other addiction. It doesn't. I mean, I don't know what to say.
Yeah.
It's just
There's
another
people
addiction. Yeah. I
yeah,
mean,
there's
like
people
when you look at the video that you show, it's clear that the gentleman needs help. I mean, it's clear that he needs help. That he
Well,
has a
he
lot of.
did fill up two questionnaires, which are very commonly used tools in diagnostic when before we diagnose someone with depression or anxiety. So the Beck's anxiety index and the Beck's depression scale. And he said that he's severely depressed according to that scale. But of course, we
Yeah.
don't use just one tool to diagnose. There are different kinds of at least 3 to 4 measurements before we provide a diagnosis of major depression or any other condition. But he is very the way he was talking about the experience when they say use a scale of 1 to 10, he became very abstractive, as in I cannot even put into words how this feeling is like. So I'm not sure if it's in the psychotherapy situation that we are working on emotions and cognitive processing. That if you tell me I don't know how to describe to you what I'm feeling, I'm not sure how it's going to help me in my psychotherapy therapy with that client. You see what I'm saying? So
Well,
I am clear. Sorry,
go ahead. Please, go ahead.
I'm clearly not 100% sold and fan of PAT because I grew up in Singapore and my preconceived notion about any drugs, even caffeine and nicotine, is that it's something that we shouldn't touch. I mean, I do drink coffee once a day, and even with that, I have a certain level of resistance. But how much of this ketamine or any psychedelic assisted therapy is a push of the pharmaceutical company, and how much is it real that the therapeutic effects are being beneficial to people who are living with mental health conditions is still a debate out there. Any research studies can tell you what they want to tell you, but what are the results out there that are not published? Because a table can have 36 results, but what about the other 36 results that we are not seeing? So I, if it helps people who are really treatment resistant, I am supportive of that, but I'm not at this moment sold about it being a mainstream treatment.
But when I look at this, and I don't know if there's a politically correct way of expressing what I'm thinking, but I feel like they're trading one addiction with another.
It's called cross addictions. Yeah,
Yeah.
it's like even if like someone is going to AA, like I'm going to AA because I'm quitting alcohol, right? I want to be sober. But I have seen so many AA attendees that if they don't go to AA, they cannot cope with that week. It becomes an addiction too. Going to AA becomes a new addiction per se. They need to go somewhere. But it's at the end of the day is which one is healthier for you. If going to AA to share, it's not going to cause you body harm or emotional or mental health harm, then so be it.
Yeah. I don't want to speak for Dee, but I do want to give him an opportunity to talk about the work he does. So one time I asked Venerable Di Hong and said, of the 10, 12 years that you've been working with inmates, incarcerated individuals, you go to prison a few times a week, different prison, and then each prison have different yards. So basically you have, like almost half a dozen to a dozen groups that you have to work with. And then in addition, when you get home, you correspond with them. I said, out of all the people that you work with that has been released from prison, the first question is that how many of them have been released? And he said about more than 1,000. And I said, well, out of the 1,000, how many actually went back? And he says he thought really hard, and he says 2. I said, you know what that means? I said, typically, if you just look up recidivism, it's around 60%, meaning that out of the 1,000 or people that you help, typically, normally, 600 of them will go back. So what happened to the 598 that you work with? Well, essentially, he cured them of an addiction. And the addiction is anger and violence. You just have to say, this is, if they don't have any tool, and the tool that we have is called mindfulness, plus a little bit more, plus compassion and all that. But essentially, we go out, we put out a set of tools, we have our procedures, we have the patience and the presence to guide them. But we're literally dealing with addicts, people who have no other choices but to react with anger and violence. And the 598 people that didn't have to go back, they're basically, they find help. And so this is, and you can argue that, well, they're also trading one addiction with another, now they become more mindful, right? But, that's how you do it. That's how you,
if we can
help people.
reframe it, you can reframe it into good habits and bad habits.
Yeah.
They're
There's
habits.
wholesome and unwholesome.
Yeah.
And so
now we have
when I see someone, I don't care how many what is the credential of the medical personnel? And I understand that they're trying to help, and I see the pain in this gentleman, and I see the joy that he gets, when he thinks that he have cured. But still, they're trading one addiction with another, and people die from ketamine, no matter how, I mean,
Yeah,
if,
I mean, our brain is such structured in this way that this reward pathway has to be rewarded. The more we feed it, the happier we're trying to get to the mood that will make us feel better. Am I not addicted to something? I'm addicted to my phone. Whenever I'm not teaching, I'm not holding workshops, I'm not cooking, I'm not walking, I'm looking at my phone. That's an addiction in its own. Why? Because it's feeding whatever reward pathway that my brain craves. So we shouldn't be judgmental as in, oh, your crime is worse than mine or your addiction is worse than mine.
yeah, no, I think that, so
Inside the inside the prisons, people
yeah,
do. If you committed, if you molested a kid, or if you raped a woman, you will get killed. Chances are, because that's worse than killing 10 men or 10 people. But anyway, go ahead.
Yeah, I know. That's why they say, oh, the rapist is killed. Good. They will get their own judgment in the jail. They are the first one to get their treatment.
Yeah.
Yeah, I know what you're saying. But I feel that, if we can train our mind to always seek what we want, but they are healthy, they help us grow, they help us thrive, then why not? So the trading one addiction for another, that one is a very sad truth that happens when they don't have those healthy, meaningful activities to help them replace the unhealthy, non-meaningful activities. So what, Bendy, thank you for what you do. I'm so happy to hear about the drop of the percentage drastically from 60% to I don't know what 0.2.
0.2%.
It really proves that meditation helps.
Yeah.
Meditation is actually a neurobiological activity helping us develop pathways to feed this rewarding activity that we need and crave every day.
Yeah, I have to be careful. I don't want people to think that I'm judging. I'm not. I'm not judging. And I do understand that people need help, and I do understand that they probably try everything else, and 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 they get their relief from this. I get it.
Yeah, I mean, and no, I think sometimes we may come across as judgmental, but I don't think you were at all. But the thing is that if you subscribe to the disease model, which is the biopsychological part, then there is this explanation about some people are more susceptible to addictions because of family history or because of their biochemical makeup. I used to be a smoker. When I couldn't understand it, then I traced it back. My mom was a smoker. My grandmother was a smoker. Whereas I'm so health conscious in how did I become a smoker? I mean, I was a teenager. I was rebellious. I just wanted to be cool. And then I got addicted per se to nicotine, and it took me about 7 times to quit. I have not been smoking anymore. But when I'm stressed, I'm still thinking, a cigarette will be so good now. But I know the moment I
That's the
pick up my,
problem. That's the
yeah,
problem. People
I know
people
the
don't
moment I
understand.
puff on a cigarette, I know I'll throw up because my body is not used to it anymore. But that biological response to it, if you use the disease model to explain it, some of us are more susceptible to certain behaviors.
So I do have to ask the follow-up question then, which is that when you gave up smoking, what other addition did you pick up in place of that?
The phone, the phone.
No, I didn't expect an answer. I won't let that go without.
Yeah.
Okay.
Well, that's all for my presentation today. I hope it is interesting and we learn a thing or two from the presentation that I shared with you. I myself learned so much by teaching this class. And if there's any questions, feel free to write me an email. My email
Thank
is
you.
Joanne K
And
at
thank you so much for coming back. You made you actually made a commitment to do 4 classes last year, and I was so surprised, so grateful that at the end you said, "Well, let's do another year." And then once the year starts, then you were so busy in March, but then you still come back when you finally find some time. So I'm very grateful to that. And I think the what did help was when the student on Insight Timer actually asked for you.
Oh,
He said, "What happened to her?" Dr. Kwan. I was so waiting for her to come back in March, and so I said,
oh.
"Okay, all right."
So I apologize for the absence, but I did make some arrangements for tonight to happen because spring usually we're a little busy with graduation and whatnots. Hopefully, I'm able to come back in June, but I'm heavily traveling in June. But I'll talk with Danny about my next date. That
Okay, yeah, I'll follow up. I'll follow up.
Great.
We'll figure
okay,
it out. We'll figure it out.
all
And
right.
for those of you who are on the different platforms, if I want to use one word to describe both Dr. Kwok and Venerable Hong is that they are care providers in their own way. You know,
We are helping
they,
professional. There's a
yeah,
term
they're
for it.
professionals, and their job is to help people. And you know, then when they hear suffering, they come. That's how we describe the Guan Yin, right? And
Well,
that's the job. Yeah.
yeah, I did hang up my clinician hat in March because I'm so busy with my academic work. So I'm fully focusing on research and teaching and administrating. So I'm no longer a clinician, but you don't have to be a therapist to be able to help. Dr. Mew is helping the community in every way. Bandy is helping the community in every way. I hope that I'm helping through talks like this, through teaching, to developing psychology
Yeah,
programs.
and I like what you said is that we actually help ourselves too. We help ourselves in the
Yeah.
process. Now, a very good example of that is Ernest Budion. He spent he spent so much time working with the inmates, and he actually said that he's going to retire in a couple of years. And then so I said, "Oh, so you're all cured now."
No, he has. I think he has changed his mind, but I'll leave it to him to share with you. He was going to retire because of the long driving, but now he has some problem focus solution. There are two kinds of coping. We either use emotion focus or we use problem focus. But he has found a solution to his not retiring. Yeah.
Yeah.
Nobody retires. Come on, nobody
You can't
retires.
retire.
Well, so I
Okay,
will come
all
back.
right. Okay, now don't go away. Let me turn off outside first. Don't go
Okay.
away. Okay,
Thank you,
so thanks
everyone.
everyone. Thanks everyone. On Inside Timer, right now we have 100 participants and 504 likes. Gratitude.
Thanks.
Uh,
Thank
All
you.
right.